I'm Jerome,
And I'm Chad.
and this is our PSA on opioid abuse. As many of you know, the president declared the opioid abuse epidemic a public health emergency. But what is an opioid? The Centers for Disease Control and Prevention, or CDC, define opioids as a class of drugs used to relieve pain. The United States Drug Enforcement Administration, or DEA, define opioids as a substance that is derived from opioid and synthetic opioids, or it's derived from opium. Most opioids come from a specific kind of poppy plant, but some are man-made in a lab. Some examples of opioids are heroin, fentanyl, benzodiazepines, and methadone.
So, why is the topic of opioid abuse such a big deal? Well, as you can see from these graphics, courtesy of the CDC, 91 Americans die every day from opioid overdose. Since 2010, deaths related to heroin overdose have quadrupled. Almost half of all opioid overdoses deaths involved a prescription opioid, and over 40 people died daily from overdoses involving prescription opioids.
So not only can opioids lead to death, but they also have serious and severe side effects. According to the CDC, these side effects include tolerance, which means the longer you take these medications/drugs, you'll have to take more to feel the same effects. Opioids can lead to dependence, meaning without the drugs, you will experience symptoms of withdrawal. These drugs can also lead to increased pain, sensitivity, and depression. These drugs can also lower your levels of testosterone, which can lead to having a lower sex drive, lower levels of energy, and decreased strength. Lastly, these drugs can also lead to constipation, nausea, vomiting, dry mouth, confusion, sleepiness, and dizziness.
According to the CDC, some things that make you more at risk for abusing opioids are having multiple overlapping prescriptions, taking high doses of medication, having a history of substance abuse or mental illness. Other risk of factors include being someone of low income status and living in a rural area. Other factors for heroin abuse include living in an urban area, between 18 and 25 years old, being a male, and being Caucasian.
With the rapid increase of opioid use in the United States, there is a need for preventative measures to take place. The Center for Disease Control and Prevention has looked at four preventative measures that need to take place in order to fix this problem. The first one is to improve opioid prescribing. Improving the way opioids are prescribed through clinical practice guidelines can ensure patients have access to safer, more effective pain treatment while reducing the number of people who potentially misuse or overdose from these drugs. The second measure is to prevent opioid use disorder. There are a variety of ways to help reduce exposure to opioids and prevent opioid use disorder, such as prescription drug monitoring programs, state prescription drug laws, management strategies, and insurance programs, and academic detailing to educate providers about opioid prescribing guidelines. It is also important to treat those with opioid use disorder and crucial to expand access to evidence-based treatments, including medication-assisted therapy. And in order to reverse opioid overdose, it is important to expand access to and use of naloxone. Naloxone is a non-addictive life-saving drug that can reverse the effects of an opioid overdose when administered in time. Individuals can also look into opioid alternatives, such as using a pain reliever with less potential of abuse, such as Tylenol or Advil, and exercising and pursuing physical or behavioral therapy. Thanks for watching. That's our PSA. Have a good one.